Good morning, I'm Dr Kerry Chan from New South Wales Health with the COVID-19 update for Monday the 6th of December 2021. There were 208 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were more than 61,000 COVID tests reported during that period. There is a total of 25 cases of COVID-19 with the Omicron variant in New South Wales. 11 of these cases were acquired either overseas or possibly through transmission on an international flight. The other 14 cases were locally acquired and are all linked to the ongoing Regent's Park Omicron cluster. Additionally, this number does not include a resident of the ACT whose transmission is believed to have been acquired through attendance at the Sydney Climbing Gym on Saturday the 27th of November. And ACT has separately reported cases linked to that resident. It is expected that our numbers linked to this cluster will rise as further results are confirmed, and we'll update you accordingly. In terms of hospitalizations, there are currently 152 COVID cases admitted to hospital, with 24 people in intensive care, 5 of whom require ventilation. To date, there have been no cases of Omicron variant admitted to hospital for COVID-related care in New South Wales. Across New South Wales, we've got 94.6% of people aged 16 and over have received their first dose of the COVID vaccine, and 92.8% are fully vaccinated. Those numbers are inching incredibly slowly upwards towards our aim of getting that 95% double dose vaccination, so thank you to everyone. In relation to our 12 to 15-year-olds, we've got 81.4% have received their first dose and 77.2% are fully vaccinated. I think there's a little bit of room for improvement here, as we'd love to see those numbers increase further. So I would urge all parents, now that school is going to be breaking over the coming weeks, to make those appointments for your children and get them vaccinated. It will be really important to have those high vaccination coverages going into next year. In terms of my key messages at the moment is we're continuing to investigate the outbreak of COVID cases associated with the Omicron variant at the Regent's Park Christian School, the Sydney Indoor Climbing Gym in Villawood, and the St Peter Chanel Catholic Primary School in Regent's Park. There are 14 cases confirmed as being of the Omicron variant linked to these venues, in addition to the confirmed case I spoke about earlier linked to ACT. The ACT also reported further transmission related to that ACT resident. I'd firstly like to just thank the incredible response of the school communities that have been linked to this outbreak. Thank you so much for turning out for testing, and thank you so much for your commitment to following the public health advice as we aim to understand this outbreak and reduce any further spread. New South Wales Health continues to work with the community to keep COVID transmission as low as possible as we learn to live with the virus. And that's why it's important that at this time, as even going into the future, we need to maintain those high levels of testing. So I urge anyone with even the mildest symptoms to get tested and isolate until you receive a negative result. And just a reminder that those simple COVID-safe behaviours that we've talked so much about over the previous periods are really important going forward. So continue to wear a mask indoors, wash your hands, maintain social distancing, and if you can choose venues or your activities and keeping them outdoor or use well-ventilated spaces, those strategies are really effective at reducing the risk of transmission of COVID. I'd like to remind overseas travellers of their obligations under the public health order to get tested in the first 24 hours of arrival in New South Wales, and again on day 6, and to remain in isolation for 72 hours, and then avoid high-risk settings such as hospitals and disability care services and correction services for that period of 7 days. Also to note that all travellers from the 8 listed countries are required to enter managed quarantine for 14 days. So again, these measures are put in place to minimise COVID transmission in our community by detecting these cases rapidly in returning travellers and allowing that public health contact tracing to occur in a timely way. So I thank everyone for their cooperation and urge everyone to still go out and get tested if you've got COVID symptoms and maintain those COVID safe practices. Thank you.